for time. I think probably most of you were here last week, but welcome to the second in our Journey to Health Equity series. I'm just going to introduce Dr. Byanami briefly. Dr. Cynthia Byanami is a seasoned nurse and researcher with over 43 years of experience in clinical practice, academia, and research. She was the inaugural director of the Louisiana Center for Nursing, where she led numerous studies on nursing workforce diversity, education capacity, and supply demand forecasting. Dr. Byanami co-led the Louisiana Action Coalition, focusing on eliminating health disparities through initiatives that promote a culture of health and increasing diversity in the nursing workforce. She facilitated Louisiana's first nursing workforce diversity think tank in 2015 and authored the Hallmark Report, Embracing the Challenge, Enhancing Diversity in Louisiana's Nursing Workforce. Currently, Dr. Byanami serves as the chair of the Acadiana Black Nurses Association Health Policy Committee and continues to advocate for addressing health inequities through workforce diversity and policy leadership. So I hope you all will enjoy our second webinar.
Thank you very much, Eric, and good morning to everyone. Welcome back to those that were with us on last month in November for our first webinar, and welcome to any new attendees on today that this will be your first webinar. I hope that you really enjoy and be engaged in the information that we'll be sharing and what we have planned for you today. Well, just we'll go to the next slide, Eric. Okay, so we're webinar 2, the health equity journey in rural hospitals. Where do we begin? And just for a brief review on what we did on last month, I thought it was very important that we made sure that we all were coming from the same perspective as to health equity and what health equity is. And so on our first webinar, we actually defined health equity. And what we saw, but there are very many definitions. Many of our federal agencies have their definitions: CMS, HRSA, the Robert Wood Johnson Foundation, Healthy People 2030, CDC, but they all have some items that are very much in common. And that is that health equity, it should be available to everyone. And it creates a just and fair opportunity to achieve their highest level of health. And that's for everyone, and regardless of their socioeconomic status, regardless of where they live, regardless of their race, their ethnicity. So the whole goal of health equity is that everyone will have the opportunity to achieve the highest level of health. Now, how we get there, there may be differences in terms of our communities that we serve, but the goal is that everyone will have this opportunity. We talked about the difference between equity and equality. Equality, it implies that one size fits all. And we know that in the reality of life, one size does not always fit all. That even within our own families, if we think about our children have different personalities. We all want them to achieve the same goal, to grow into healthy, productive human beings. And so in order to do that, we have to meet them where their needs are and give them the resources that they need. This is the same in terms of our health situations, that we have to make sure that we may have the medication that is the best medication for 2 individuals. The medication is available at the pharmacy, but one person may not be able to afford the medication and may need assistance in helping to purchase that medication, whereas another person is able to purchase. So equity has to do with making the right size solution based on each individual's needs. So health equity is important. Why is it important to rural hospitals? Because it addresses the unique challenges and barriers that rural communities face in accessing health care, leading to better health outcomes for rural communities. And we also talked about all the different definitions, the terminology that goes along with this discussion and this development of this health equity plan. The social determinants of health, social drivers of health, health-related social needs, health disparities, health inequities. So those definitions all play a part in our understanding of health equity. We also address that in terms of health and healthcare outcomes, and we know about our county health rankings, and Louisiana is usually at the bottom of those county health rankings. But we have a goal that we're going to be moving forward, that we're going to be going up that ladder and not at the bottom of the ladder. We also know that the clinical care that we provide has 20% of the impact on our health outcomes. And those health-related social needs, those social drivers of health, have approximately 50% of the impact on our health outcomes for those that we serve in our community. So that's why it's so very important that we address these health-related social needs, the social drivers of health. So, and we also ended our discussion with acknowledging how important it is to have the commitment from our leadership within our healthcare facility, within our hospital, those in the C-suite, those in the boardroom, to have a commitment to health equity. If this health equity plan is going to be developed, implemented, and the information used to really improve healthcare outcomes. Okay, thank you. Next slide, please. So today our objectives are to discuss the value of conducting a health equity plan gap analysis for rural hospitals as a first step in creating a health equity plan. And you probably, if you Google it, you'll see all kinds of information about a health equity plan, health equity gap analysis. I plugged the plan in there because I think before we can actually start doing that gap analysis and looking at the data and seeing where the gaps exist, that you must have a plan in place in order to how we're going to conduct this. Having a plan contributes significantly to the success of a project by providing structure, clarity, and direction. Starting without a well-defined plan risks inefficiency, result in fragmented efforts, and outcomes that fail to address the root causes. And again, I said root causes of health inequities effectively. So again, we're just going to take a look at what do we need in order to develop this well-focused, comprehensive plan. Our next objective is to describe how community health needs assessment serves as a tool to pinpoint key health disparities in rural communities. And we're going to talk about how that is a key document, key information that will help you move forward in developing this health equity plan. Then we're going to examine how the Centers for Medicare and Medicaid Services, CMS, screening for social drivers of health measures can identify and address health disparities and inequities in rural communities. And finally, we're going to end with something I'm very excited about. We're going to actually be hearing from one of our colleagues. We're going to learn about the health equity journey from the experience of one of Louisiana's critical access hospitals, providing a practical perspective on challenges and successes. So I'm looking forward to that, and I'm sure you will be too. Next slide. So what is a health equity plan gap analysis? Before I do the plan, I'm going to look at the health equity gap analysis. And it's a systematic process that involves examining healthcare data. Okay, so where we're going to get that data from to uncover disparities and inequities in health outcomes across different population groups. Where are we going to get that information from? This analysis helps organizations identify specific gaps in achieving health equity, enabling them to target interventions, develop interventions and strategies to address these disparities and improve care for underserved communities. And that's great. That's a step that needs to be taken. But before we can ever get there, I have said that a health equity plan gap analysis is necessary. And again, this depends on where you are on your journey. You may have already done this. You may already have your plan in place. But I'm going from the perspective that we're starting from A, B, going to C. So a health equity plan gap analysis is a systematic self-assessment process that rural hospitals can use to evaluate current practices, identify gaps, and align challenges and opportunities in creating a comprehensive health equity plan. This is kind of a self-assessment. These are lists of things that we know we need to have in order to develop this plan, and to look at that and say, what do we currently have in place? Guided by evidence-based frameworks, this process focuses on addressing critical areas to reduce health disparities, improve care for underserved communities, and support equitable healthcare delivery. So this health equity plan is going to allow us to look to do like a initial self-assessment of what do we currently have in place, what do we need to have in place, or what we're in the progress of having in place. Okay, next slide, please. Okay, what are the key elements of a health equity plan gap analysis? And you're going to see that some of these key elements are also going to be a part of your health equity plan. So we've got key elements of a health equity plan gap analysis: leadership and organizational commitment. And again, like I said, we talked about that during our initial webinar, but health equity is, leadership is absolutely critical in an effort to really develop a plan and implement the plan. You must have leadership and organizational commitment. And we're going to talk a little bit more about that as an example. Policies in government. Are there policies specifically in place for this, addressing this health equity plan? And we know that a policy is a statement that clearly outlines the rules, guidelines, and regulations that an organization follows in communicating the official stance on a particular issue or area of operation, often including the rationale for this policy. So having a policy, a written policy in place for your organization is essential as it relates to health equity. And as you develop your plan, you're going to develop additional policies for each step of the way that address the implementation of that plan. Governance is the process of overseeing the direction of an organization. It also refers to the system of rules, processes, and practices that govern a company or an organization, in this case, a rural hospital. So you want to make sure health equity is embedded throughout the policies, the governance, the procedures within your healthcare facility. Okay, next we're going to look at data collection and analysis. Okay, what do we mean by data collection and analysis? Or is there data available, demographic data for the clients that you serve within your rural hospital? Are we collecting that data? How are we collecting that data? What type of data are we collecting? Race, ethnicity, gender, language, socioeconomic status. What data are we currently collecting? Are health disparities identified and tracked over time using standardized metrics? That may not be so, or you may be in the progress of doing that. Identify where you are. Does a hospital use data to prioritize health equity initiatives and measure progress? So these are some of the questions that you would ask yourself in terms of data collection analysis. And sometimes we really get, with that word analysis, we get a little eerie about that because, we think statistics and, we're going to have to hire a statistician. Analysis, looking at your data, and most of the time you're going to be looking at what percentage of the clients that you serve are experiencing certain health related social needs. And so we're going to talk about how that process goes. But I don't want you to get overwhelmed with some of the terminology and some of the key steps involved, because I believe that every one of you already have certain things in place that will put you way ahead in terms of developing this health equity plan. Social drivers of health and health-related social needs. We defined those at our last webinar. We're going to talk a little bit more specifically about how do we measure for those on this webinar. Access to care. What do we mean by access to care? Are there barriers to care for underserved populations, such as cost, transportation, language? Are extended hours or mobile clinics offered to improve access? Does a hospital provide telehealth services? So all of these are things that we can ask ourselves as we begin to develop our health equity plan. And then we have patient-centered care. What do we mean by patient-centered care? Are patient education materials available in multiple languages and appropriate for literacy levels? Are policies in place to address patient complaints and suggestions related to health equity? So really looking at the patient and focusing on the patient. Are we doing those, incorporating those steps within our health equity plan? And then we look at workforce diversity and cultural competency and cultural humility. Is the workforce representative of the diversity of the community served? Are hiring practices designed to promote workforce diversity? Are there policies or practices to support staff in addressing the needs of underserved populations? Are cultural competency and cultural humility and implicit bias training available for staff and the leadership? And I always like to use, we use the term cultural competency often, but it implies that we become competent in others' culture, in everyone's culture, and we can't do that. I prefer cultural humility, having a humble and respectful attitude toward people of other cultures. It involves self-exploration combined with a willingness to learn from others. It helps us recognize our own cultural biases and realize that we can't know everything about a culture. We learn from our patients and their families and acknowledge their cultures and how these practices affect their health without making any assumptions. So that's kind of the terminology that I prefer to use. And then we have community engagement. And our next webinar is really going to go into community engagement because that's absolutely essential in terms of our health equity plan. And we're talking about is the work, when we're talking about community engagement, we're looking at we're working with members of our community in terms of community engagement. Does the hospital maintain active partnerships with local organizations to address social determinants of health? Are there mechanisms for regular community feedback on hospital services and equity efforts? Are community members, especially from underserved populations, involved in planning and implementing health equity initiatives? So we have to ask ourselves those kinds of questions as we begin to look at the role of the community, engaging the community in this effort. And then we're looking at financial and operational sustainability, something that we really don't like to focus on, but is absolutely essential to move our health equity plan forward. Are health equity initiatives included in the hospital's annual budget? Are partnerships with local organizations providing in-kind or financial support for equity initiatives? And are there processes in place to evaluate the cost effectiveness and impact of health equity efforts? That return on investment is very important. That's going to be very important to your C-suite, your board members. Okay. And next we have evaluation and continuous improvement, which is always important from the beginning. You have to determine how are you going to evaluate the impact of this health equity plan. So is there a structured evaluation process to measure the outcomes of health equity initiatives? Is that in place? Or does the hospital have a timeline and milestones for achieving health equity? And are successes and challenges communicated with stakeholders to maintain momentum and support? So these are just some, not all of the areas that we need to look at when we're even thinking about developing a health equity plan. And hopefully for our next webinar, we'll have this table, and it's just a draft of a table that you can also use in order to do that self-assessment for your organization. Next slide. And I just gave you an example. This may be what the plan looks like. And this is just an example. You may want to add some additional areas in there. But with looking at the plan, you can see it adds leadership for the key element, leadership and organizational commitment. Does the hospital have a formal mission, a vision statement? And you can see here, well, it says it's in progress. Is there a dedicated leadership role? Are teams responsible for advancing in progress? Are health equity goals integrated into the hospital strategic plan in progress? Does the hospital leadership provide regular updates and reports on health equity efforts? And at that time, no. But you can also see in the comment section that there's a health equity team has actually reviewed the mission vision statement, and they made recommendations for revisions, and they plan to present that to the board at the January 9th, 2025 meeting. And again, this is just an example. And then the health equity lead officer has been appointed, but the health equity team is not currently in place. And so they're in the process of looking at representatives both within the health hospital and within the community to take part and to be a part of this team. In terms of the goals, the health equity team will ensure that health equity goals are developed and integrated in the hospital strategic plan by March 15th. So you realize that you're gathering your team. So they've set a date, March 15th, that they're going to look at these goals and see and determine if they're being integrated within our current strategic plan. And then the health equity officer is scheduled to meet with the hospital's leadership members January 9th. And one of the goals is that they want to have health equity on the agenda for every board meeting, which is very important. So these are just saying you would probably may come up with something totally different, something similar, but it gets you to thinking about these are things that we need to have in place for our health equity plan. Okay, next slide. So now we're going to move forward to our assignment from our webinar one. We had just a assignment that because every hospital has to produce a community health needs assessment. And a community health needs assessment is a valuable tool to use in developing a health equity plan. So with our community needs assignment, we had to ask that you share the top three. Go to your community health needs assignment and identify the top three priorities identified in your hospital's most recent community health needs assessment. Using only 1 or 2 words for each priority. And Eric is going to help us do this by developing a word cloud. So Eric, it's in your hands.
So everyone, you can go to on your computer menti.com. If you look at the top of the screen here, it's menti.com, and it's going to ask you for a code when you get there. This is the code that you'll punch in, and then you can just type in either on your phone or your computer, the top 3 priorities you identified in your hospital's community health needs assessment. So again, go to menti.com, punch in this code, and then you can write your top 3 needs identified.
We see transportation, specialty services, transportation, okay. Mental health, transportation, mental health, health literacy, adolescent health, specialist physicians, cancer, mental health. Okay. Well, thank you. It appears based on our word cloud that we have, again, even though each community is unique, there are definite commonalities. Transportation seems to stand out. It seems to really stand out along with mental health services. We have adolescent health, cancer, Awesome. So this is great, and I truly appreciate you all doing this, going to your community health needs assessment, reviewing those documents, and seeing what the priority areas are. So you can see that you're well on your way to really beginning to look at the what are the priorities for developing your health equity plan. So I thank you very much, and Eric, we will be able to save that, right?
Yep, I'll take a
Okay.
photo of it.
Great, great, great. This is great. And one of the reasons I'd like to do this is because we can see how the commonalities that we have within our communities, but we also identify some of the uniquenesses of our communities. But again, we are well on our way. Okay, so I'm ready for our next slide. Thank you so much for participating in that. Thank you. Ready? So I know I'm probably preaching to the choir, but again, I always like to make sure we're all on the same page. So what is the community health needs assessment? I think everyone knows it is a systematic process that identifies and prioritizes the community health needs and then develops a plan to address them. The Affordable Care Act requires nonprofit hospitals, including critical access hospitals in the United States, to complete a community health needs assessment every 3 years. And I actually went on and I Googled many of your community health needs assessment, because one of the things is that they must be made available to the public. And I was very impressed with some of very, very complex, but they're all very informative. Okay, Eric, we can go to the next slide. Okay, so what is a community? We say we have to do this community health needs assessment. So what is the community? It goes outside of the healthcare facility, really looking at the community that healthcare facility serves. So for a rural hospital conducting a community health needs assessment, community is defined as the geographic area surrounding the hospital that includes the population it serves, considering factors like distance to access healthcare, local demographics, and shared health concerns. Often, and I think this is so important, often extending beyond the immediate town or county boundaries to encompass the broader rural region that relies on that hospital for care. Okay, next. So what are the strategic components of the community health needs assessment? And as we're going through these, I want you to remember what those key elements were for the health equity plan gap analysis, because some of the wording may be a little different, but some of the information is very similar. And that's what I want us to keep in mind as we go throughout this process, is that it's not like you're starting from scratch. You already have a basis for tremendous information for developing this health equity plan. So what are the components of the community health needs assessment? Identifying community health needs is the ultimate goal. Involving community stakeholders in the assessment process. Isn't that what we want to do with our health equity plan? We want to involve them in that health equity plan from the beginning of the process, because those stakeholders provide resources to help address whatever those health needs are for that community. Prioritizing community health needs. Of course, we have to prioritize. We may have 10 that we identify in our community health needs assessment, but then we have to prioritize and we have to decide on what type of criteria are we prioritizing those community health needs. Including members of medically underserved, low income, and minority populations in the assessment process. So making sure the process is representative of the people that are being served by that healthcare facility. All people, remember health equity, we want to give all people the opportunity to have the best health possible. Identifying health and healthcare resources. What are the health and healthcare resources within our community, within the community that we service? Because if you don't know what the resources are, you can't refer the patient. And so if we can't refer the patient, then that patient won't have access to those services. And what we're doing is we'll be seeing that patient very soon within our healthcare facility. including public health professionals on the assessment team. That's so important because our public health professionals have that knowledge and that capacity to share about what is available within our community. What are the services provided by our public health departments within our community? So it's very important to have them as a part of your team. Developing implementation strategies to address health needs. And one of the things about the community health needs assessment is that many times we can have this wonderful document, and some institutions may even hire consultants to help them to do this community health needs assessment. But it has to be a working document that, okay, this is the information that we've gained. Now, this is a plan that we've developed. We've actually developed an implementation strategies to address these health needs. Very similar to what we're talking about, the health equity plan. So I always want to go back to, how does this relate to the health equity plan? Conducting the assessment a minimum every 3 years. Okay, so our most recent community health needs assessment, they may be on different dates. Some may be for 2023, some may be for 2024, some may be for 2022, but that's a great starting point. And then reporting results publicly, always making this information available to the public. So these are the strategic components of our community health needs assessment, which all of you are doing. So every hospital has community health needs assessment. In doing some of my research, I understand that some hospitals may come together to do a community health needs assessment, and there's certain criteria for that as well. But your hospital must be involved in a community health needs assessment. So that's valuable information that you already gather and have. Okay. Next slide. So what questions are answered by our rural hospitals community health needs assessment? What are the questions? What are we going to, after we've completed this assessment and worked with our community and worked with the patients that we serve and worked with public health, what are the questions we're trying to answer through this community health needs assessment? What are the problems and what are the health problems in our community? That's probably the number one question. What factors are behind the health problems we have? What are the root causes? We can see a patient, and a patient comes in with elevated blood pressure, and it's to the point now that they have to be serviced in the emergency department in order to bring that blood pressure down. Well, we get that done. The doctor recommends, a healthcare provider recommends, give the patient a script for blood pressure medicine. The patient goes home. There's a situation where there's not enough money to purchase the medication, so the patient ends up again next month. So we never identified the root cause of what was contributing to this health problem. So that's so important. And again, that's where that health equity plan and implementation is addressing. That's what it's addressing. What resources are available to address the health problems? Again, what other resources in our community? Where can we refer this client to? Once we've assessed, and of course, if we don't ask the question, we're not going to get the answer. So we have to, at some point, when that patient's admitted, to have to ask the question, are there some issues related to you being able to purchase your medication? And next, what plan can we put in place to address identified health needs? And I know that that's a concern for many healthcare providers, is if I ask this question and I don't have anything in place to help this patient, then I feel like I'm doing more harm than good. Well, our goal, the whole goal behind all of this, is that pulling the resources together so that we can have that information to share with our patients. What are the health needs of our community from a population-based perspective? And so overall, looking at what are the health needs of our community, and community is so important. Again, community health needs assessment. Okay, next slide. So we have a poll question. Trying to get it engaged, everyone keeping, because we want to hear from you. And so now we're going to go to, does your hospital complete the screenings for social drivers of health? Does your hospital complete the screenings for social drivers of health? If you can respond to this poll question. Does your hospital complete the screenings for social drivers of health measure? Yes, no, or if you're unsure, that's fine as well. Mm. Eric, are we getting any responses or?
Yep. Sorry, I thought you could see them.
No,
Can you see them
now,
now?
okay, 94%, okay, and 6% unsure. Great. Okay. And our next, that's great information. Our next slide. Poll question number 2. Does your hospital complete the screen positive rate for social drivers of health? Does your hospital complete the screen positive rate for social drivers of health? I don't know if the results are populating, but okay. 85%. No, that's yes. Then we have 8%. No. And then we have 8%. Unsure. Okay. Well, that's great information. And I guess you know why I'm asking that. We must be leading to something with our next slide. Again, what we're talking about today is, again, looking at that gap analysis, that health equity plan gap analysis, and then beginning to look at the information that we're already capturing through our community health needs assessment, and now screening for social drivers of health measure. Again, information we're already collecting, and how all of this, we can merge all of this together in creating this health equity plan. Okay, so I feel like I'm speaking to the choir, but we'll go on and make sure that we're all on the same page in terms of our screening for social drivers of health measure. And I'm gonna not going to spend a lot of time because I want to make sure I give our guests enough time for her presentation. So in fiscal year 2023, CMS included 2 new measures that hospitals participating in the hospital patient quality reporting program were required to report. And that was the number of patients admitted to the hospital who are 18 years old or older at the time of admission and are screened for all of the 5 health-related social needs. And we'll talk about those 5 health-related social needs. And then that's the numerator. And the denominator would be the total number of patients admitted to the hospital who are 18 years old or older on the date that they are admitted, which is our measure denominator. And the thing here, starting, yes, as of 2024, CMS mandates that critical access hospitals must screen patients for social drivers of health, meaning they are required to assess patients for these health-related social needs that we're going to address in just a minute. And the whole goal of doing this, and that's what I always like to know why I'm doing what I'm doing, is that by identifying social needs, healthcare providers can better address potential barriers to care and improve patient outcomes. That is the whole goal behind this. So what are those health-related social needs that we're supposed to be addressing? Well, food insecurity is one. And food insecurity, I think you all are familiar with it, is defined as limited or uncertain access to adequate quality and quantity of food at the household level. And then there's housing insecurity. Housing instability means multiple conditions ranging from the inability to pay rent or mortgage, frequent changes in residence, including temporary stays with friends and relatives, living in crowded conditions, and actual lack of shelter, housing in which people are homeless. Transportation needs. Unmet transportation needs include limitations that impede transportation to destinations such as to healthcare providers, to see their healthcare providers, to work and for daily living activities. Utility difficulties. Inconsistent availability of electricity, water, oil, and gas services is directly associated with housing instability and food insecurity. And interpersonal safety. Assessment for this includes screening for exposure to intimate partner violence, child abuse, and elder abuse. And then within this measure, they've identified areas that can be excluded when we're screening for patients. And that's patients who opt out of screening, who desire not to participate in the screening, and patients who are unable to complete the screening themselves during their inpatient stay and have no legal guardian or caregiver able to do so on the patient's behalf. So the social drivers of health measure. So at this point, all of our critical access hospitals, rural hospitals should be screening for these social drivers of health measure. Okay. Our next slide. So there's a second part to this measure, and that's screen positive rate for social drivers of health. So it's like we're collecting this data about these health-related social needs. Now we have to have a numerical value for in terms of those in setting priorities as to what health-related social need is most prevalent in amongst the 5 that we're screening for the community that we serve. So the screen positive rate for social drivers of health provides information on the percentage of patients admitted for an inpatient hospital stay, again, who are 18 years or older on the date of admission, were screened for all 5 of the health-related social needs and screened positive for 1 or more of the health-related social needs. And we've identified those 5 health-related social needs. Now for the screen positive, we're actually going to be looking at, again, those who actually screened positive. So our measured numerator is the number of patients admitted for an inpatient stay who are 18 years or older on the date of admission, were screened for all 5 of the health-related social needs, and who screened positive, which means that they, however you assess them, and there are many ways to assess them, they're evidence-based questionnaires that are provided. CMS has a questionnaire, the Accountable Health Communities questionnaire. There's a Family Academy of Family Physicians questionnaire for measuring health-related social needs. There are many questionnaires available that you can select for, and how you will determine if you assess for these health-related social needs, and how you determine if there is a positive for this screen positive. And your denominator is the number of patients admitted for an inpatient stay who are 18 years or older on the date of admission and were screened for all of the 5 health-related social needs. So at this point, you have the same exclusions. But what you're doing is you're actually looking at, okay, this is the percentage of patients that we actually screened for health-related social needs in that measure. The second measure has to do with the percentage of patients that were screened. Of that percentage, how many screened positive? What was the rate of those that screened positive? And these are based on individuals. So you're going to look at the rate that screened positive for food security, the rate that screened positive for housing insecurity, the rate that screened positive for transportation needs, and so forth. So this gives you a tremendous amount of information when we're talking about health equity and developing a plan, implementing the plan as to what our priorities should be. We're in terms of our health-related social needs. And so again, since this is information that you're already collecting, or that you've collected for 2024 for sure, and that going into 2025, at this point, I'm not aware of any benchmarks for health-related social needs for in terms of the screen positive measure or the screening measure, but they may be forthcoming. But again, this is very important information that can be used as you move forward in developing your health equity plan, determining what your priorities for in terms of your health-related social needs. There's so much information, and I'm sure you're probably aware of that. But there's a wonderful Q&R document that's available, and I put that in our resources that can answer just about any question that you have related to the screen positive rate, and also related to the measure as a whole, the screening for social drivers of health measure as a whole. And so I wanted to make sure that was available to you. And we can also, on our next webinar, we're going to move forward a little bit, but I want to make sure that we identify all of the information that you're already collecting that will help to contribute to developing a health equity plan. At this time, I'm going to stop because I want to make sure that we have time to hear from our guest speaker. Next slide, please. We're hearing from one of our own colleagues. This is Miss Kathy Terry. Kathy is the community champion for West Feliciana Hospital. Kathy is a healthcare business development Six Sigma Master Black Belt strategist, specializing in marketing, communications, and public relations within the healthcare industry, with over 25 years of experience working with rural community hospitals and physicians. She brings her expertise on how to create and implement solutions to bridge gaps in healthcare access and outcomes within rural communities. As a resident of West Feliciana Parish and a strong advocate of the quality and availability of healthcare in rural communities, Kathy was excited to accept the position as the Delta Region Community Health Systems Development Program Community Champion for West Feliciana Hospital. In her role as the community champion for West Feliciana Hospital, Kathy has effectively implemented population health strategies and forged partnerships to identify, address, and enhance healthcare and resource requirements in the community. Kathy's work also emphasizes the importance of integrating social determinants of health into care models, resulting in effective patient outcomes. Kathy and her husband, Steve, reside in Lake Rosemont, a community in West Feliciana Parish. Now empty nesters, Kathy and Steve are very active in the community and enjoy lake living and their Labrador retrievers. Thank you so much, Kathy. Thank you.
Wow, that made me sound important.
You are.
Oh, good afternoon, everyone. Thank you for this opportunity to share our journey here at West Feliciana Hospital. 3 years ago, in 2022, we entered a program to address all of the SDOHs in the community and to put it all together and see how we can systematically take a look at all of our documentation, all the data that we have everywhere throughout our system, and partner with the community to bring health care to areas that we have residents that can't make it to us. So I have been extremely fortunate because we have a great senior leadership team here that is extremely supportive of this initiative and the sustainability to continue through this journey. So when I started, I took a look at all of the different data points that we had within the system, everything from patient discharge information to our health equity program that we currently had in place, which was, I think we all do that throughout our hospital, but in our case, it wasn't as organized as it probably could have been. And so going through this process, I was able to gather the data using the census information. You talked about the community health rankings, county health rankings. That's a great resource. But the biggest resource from data is in our in our records on our patients. So when we took a look at the different areas of the social drivers, what we needed to do, we looked at our needs assessment that we did. So we took a look at that data, we compared it to our actual data within the hospital, discharge, for example, or missed appointments. And we were comparing that, like, why are all these people missing these appointments? Is it, what's the reason? And so looking at our needs assessment, transportation was the number 2 area of concern. People couldn't make it to appointments. They hadn't seen a physician for 1 to 3 years because they didn't have transportation to a healthcare provider. So right there was an easy flag. So it's not like you're data mining and having to get down deep into the weeds, because data and data mining can be extremely intimidating, and there's so much data that we have. So picking off just little things like that based off of our needs assessment, and that is probably one of the important documents that you're going to have with the data, because it actually gives you feedback on what the community needs are. But also taking a look, when I came here, we work with our local government and our sheriff's department and our fire department. We have our own EMS service. So we had community partners already established, but we wanted to formalize them a little bit more and bring in other resources, from Medicaid, Medicare resources to private insurance resources, to the library and to the school, and to facilitate those relationships so we could have resources. So when we do determine a social disparity, we can, or a SDOH, we can actually refer them to these outside resources, because we're healthcare. So, but there's a lot of things that impact outcomes of healthcare. And so identifying partners that can help you address some of these situations. My concern has always been, if we have a patient that comes in and they indicate that they have a housing issue, and we don't have a resource to refer them to, what happens to that patient? So we're collecting data for what? And our concern is to take care of our patient, to provide quality care, and that includes making sure that they have a safe place to sleep at night, and heat and electric, et cetera. So, as healthcare providers, I think that we have more of a responsibility than just treating a symptom or an issue. We're looking at all of the other things that impact their life. I do want to say one thing. You pointed out the social drivers of health and the 5 areas that you were talking about. When you look at your county health rankings, and look, and I'm sure most of you have been on it, but if you go on that site and you put the county or the parish that you're in, it actually pulls up all of this data, and it's categorized, from a clinical care perspective to mental health behaviors or health behaviors, environmental, and then social and economic resources or needs. And so when you look at that and you see something, let's just say it's on the mental health, you can click on it, and it actually click on the section, and it actually gives you great definitions of your parish and what those needs are, and what it means when they have the numbers. One thing that is helpful on there, it gives you the ratio of providers to patient ratios in there, which is really interesting, because in rural communities, we all know that sometimes specialists and different services aren't available, or we can't provide them, but maybe somebody else in another area can. And so putting that all together, I think, is extremely important to have for planning, but to actually carry out our jobs as healthcare providers. I know I'm kind of going all over the place. There's just so much to do. And when you're looking at your needs assessment, one of the things that jumped out to me was we were sitting in a leadership meeting and everyone started to talk about all these new services and that could come out of our needs assessment. And so I wanted to kind of pull everybody back to take a look at what we currently have and are we reaching the people in our community with our current services? Because it's great to start your strategic planning for new opportunities with new services, et cetera. But you can also benefit out of your current services in approaching the needs of the community or being able to reach the people in your community with your current services. So it's like you hit that why and you go one way for the new business or new opportunities, and then how to increase and grow your current services and provide them or reach the outlying residents in your area. So relying on your community partners and gathering them all together as a group is a really good way also to collect some of this information, because they're all looking at it from their perspective. From a mental health perspective, you have the sheriff's department, they're looking at how many people they pick up that have mental health issues, or how many times they get called out to people's homes and the different areas that they're going to. So they're bringing a different perspective than what what we have within the hospital. So even the school, from kindergarten through 12th grade, or however your school systems are, the teachers, they have wonderful information because they're seeing things on a day-to-day basis that we might not see in our peds clinic or within our hospital. And so listening to their perspectives and coming together as a group helps the bond between all of the partners focus on or determine a particular area to work on and how to work on that together. So in 2023, our needs assessment was done at the beginning of 2023, and mental health was our number one need in the community, and then transportation. So in 2023, we focused on mental health and bringing in all of the different partners. We were all able to take an aspect of mental health or how to help our community from that perspective. And we all walked away with a game plan, and we were all able to work together to help fill some of the gaps that we had with the mental health issue here in the parish. In 2024, we made it a little bit more formal and actually had to have the completed healthcare disparity plan in place. We're Joint Commission, and so that is one thing that was required for critical access hospitals in 2024. So we went back and we took a look at that needs assessment, even though it was a year old, and transportation being the second need or highest need on that assessment. I started to look at our inpatient discharge. And so we determined that our average rate of discharge was X, but when we started to see some outliers, like maybe 90 minutes or 180 minutes, what were the reasons? So we could go back to that health record and take a look in it, or the discharge papers, and see that they were waiting on transportation. They didn't have transportation. So that kind of like flagged, and that was an easy cross to determine from a health disparity. So we decided to work on transportation. So how do we get patients when they're discharged to their area if it's way outside in the community? And so partnering, for instance, with Council on Aging comes and helps us with that. So, again, and then other partners too that have courier service or patient transfer services. So being able to rely on those community partners for something that simple of getting a patient from the hospital back to their home has now turned into, how do we get that patient from their home to the hospital or to their provider for care. And how do we provide them, with their medication? Council on Aging does a lot of that here in our parish, but there's we've also utilized the sheriff and the fire department and to help with things like this. So it's really important, I think, to just take a look what you currently have as far as data, and just do it on a top surface level. Don't get down deep into the weeds. You can, and we do get down into the weeds, but it's easier to take a look at what's right in front of you to help that patient, because it is our responsibility.
Kathy, thank you so very much. I just want to take, I know we're right at our mark right now, but if anyone has any specific questions for Kathy, if you can put it in the chat, please do so, because I think she is just a wealth of information. Kathy, we appreciate so much how you trying to, again, this can be a very complex process, but then we have to keep our focus on what is the goal. And like you said, try not to get into the weeds, but begin with what's right there, like what is the lowest hanging fruit, or what's
Right.
that we need to address, and begin the process then. And your examples of how you've used this information, I think is just awesome. So thank you so very much.
And
For
then look,
sharing.
I know that it was kind of generic and kind of all over the place. There's so much to all of this, and we could talk for hours about it. And I think you and I have talked a lot about the details. But in just looking at some of the names on here, I see Leah from Hood. Leah and I go back and forth and bounce off of each other quite a bit. We help each other through some of this. And I think utilizing partners with other hospitals also in the state or in your community or healthcare providers is great, because we're all here to help each other, because this is really difficult to do by yourself. So if you have any questions, you can email me. I can show you our plan. And yes, Joint Commission, when they came in, that was the second document that they wanted to see. They wanted to see our health disparities plan. They wanted to see our data that we're currently collecting and how we're going through that format. So it was really important that we had that.
Well, thank you again, Kathy. Thank you very much. So our next slide, I appreciate everyone that's still with us. Eric, can we have the next slide? And we're in our process of closing. And I just wanted to share this quote from Dr. Nunez Smith. Dr. Smith is Associate Dean of Health Equity at Yale School of Medicine. And what she says is, I think we have to push back on an instinct that the fixes are quick. There is not a checkbox where we can say, do these 3 things, but it is a process. And if we can do more in partnership generally with the communities that have been most affected, that's how we begin to establish trustworthiness. And again, that's how we begin to truly make a difference. Next slide. And these are the resources and references for, and the next slide. We'll be having our webinar number 3 on January 9th, and we'll explore the Joint Commission's requirements to reduce health disparities and how that's another source of data for our health equity plan. And we'll also be addressing more, delving more into engaging community members in the rural health community journey. And Kathy has really shared how she's facilitated that process within West Feliciana. So thank you very much. And then our next slide. Happy holidays. Happy holidays. There's no assignment for this webinar. We just hope that you and your families will have a wonderful holiday season. Again, thank you for staying with us. And our final slide, I think, is we'll have a quick, we're asking that you do a brief evaluation of this webinar. Again, we thank each and every one of you for taking time out of your busy schedule for participating, and we look forward to seeing you in January 2025. Thank you very much.